The European Genomic Data Infrastructure project works on enabling access to genomic and related phenotypic and clinical data across Europe. Building on the 1+MG Genomes initiative, the GDI project is making this a reality by creating a secure and efficient network where genomic and phenotypic data can be shared and analysed across Europe. We're empowering researchers to accelerate groundbreaking discoveries and improve healthcare for everyone. This video demonstrates the latest technical achievements in GDI. In particular, we are going to focus on looking up variant summary data in and across GDI datasets. You might be asking yourself, well, what does lookup variant summary data mean? And it's a great question. It's essentially checking datasets to see if the DNA change you're interested in has been observed somewhere else before. Let's take these three populations, for example. We can see that some people in more than one population have a particular DNA change. Looking up variant summary data simply means counting how many times we see a change like that. And in this case, the answer is twice. Well, why is that useful? Well, we all have DNA changes. It's what makes us who we are. In fact, each of us has about 5 million single-base DNA changes in our entire genome. The challenge for scientists and clinicians is understanding which of those many changes are actually associated with disease in our patients. The ability to understand the frequency at which we see a DNA change and if we're seeing it in people with the same phenotype or physical presentation is really informative. Let's look back at those groups again and let's imagine a scenario where the two individuals who happen to have the DNA change we're interested in have also had a severe reaction to COVID-19. Equally informative is if we don't see the DNA change in people who don't have the same phenotype. So if we look at our example here again, everyone who doesn't have that particular change has not had a severe reaction to COVID-19. The question, is this a coincidence, or is it perhaps that the DNA change might be driving that severe reaction? Now let's imagine that all of those people are in different countries. How could a user gather information from multiple countries at once, quickly, without moving data across borders? I think we know the answer, and it's the European Genomic Data Infrastructure project. Let's take today's scenario. A young man with COVID-19 presents to the clinic. There are no demographic risk factors that suggest he's at risk of a severe infection, but his presentation is unexpectedly severe. Sequencing data is available for this patient, and a DNA change is found in the TLR7 gene. This gene does have some links to severe COVID-19 outcomes. This particular change is predicted to result in a complete loss of function of the gene. This means that the gene won't make any working protein product. The team treating this patient have never seen this particular DNA change before. The team decides to use the European Genomic Data Infrastructure to try and identify other COVID patients who have had a similar severe clinical presentation and that have a similar or same DNA change. It's all about gathering multiple cases and gathering evidence to suggest that this change might be driving that adverse reaction. The Allele frequency browser is a website deployed by the Genomic Data Infrastructure project that allows users to look up a particular DNA variant, like we described before, in and across GDI datasets in a federated way. So I'm going to take that particular DNA change that the patient with COVID-19 had before. So it's on the X chromosome, it's at this position on the X chromosome, and it's a single base change from a T to a C. We're going to use this particular reference genome, and we want to look up other COVID cohorts to see if other patients happen to have this variant too. If I click search here, the Allele frequency browser will start to load. The Allele frequency browser has returned some results to us. We can see responses from the Finnish, Spanish, Swedish, and Portuguese GDI nodes. What we see here is how many times this particular DNA change that we're interested in is seen in those nodes and in what populations they're seen in. We can also understand how commonly they are seen in those nodes. And the allele frequencies that you see here are indicative that this DNA change is quite rare. That's an interesting and useful piece of evidence because severe reactions to COVID-19 are also rare. If we saw that this change was particularly common, it's probably not driving a severe and rare reaction to having COVID-19. This is a great example of how the European Genomic Data Infrastructure can handle a federated query. And what that means is that the data has not left these nodes. It exists in the Finnish node and in the Spanish and in the Swedish and in the Portuguese nodes. This shows the European Genomic Data Infrastructure's ability to answer real-world questions from clinicians and scientists in a way that doesn't involve moving data across borders.